Compare and despair. It is human nature. We all do it to some extent. Am I thin enough? Is my car fancy enough? Is my topic as compelling as the last 5 speakers I just heard up here? Social media has leveled up on this. It has taken compare and despair to the next level. Now, is my vacation as fun as my former neighbors? Am I having as much fun as they are? Are my kids as adorable as my high school classmates who I haven't seen in 20 years? Is my lunch as photogenic as my neighbors? We're comparing and despairing all the time. And young people are the most vulnerable to this. They are inundated with images from Facebook, chat, Snapchat, Instagram, TikTok, and I'm sure many others all day long. And what they see are beautiful people having perfect lives. And they're comparing themselves and despairing because of that. New phenomenon, Snapchat dysmorphia. These kids are seeing these altered images of celebrities and their friends and acquaintances and influencers, and they are comparing themselves to that and putting their images out there filtered. They're running them through Facetune, through Peachy, and through other apps to change the way they look and to change their teeth. And now they're going to us, general dentists, and plastic surgeons in record numbers, 5 times more than 5 years ago. It's quintupled over 5 years. And we've all seen it in our practices, I think. They're out there looking to have their teeth changed into these more perfect images. And here's a story I hear all the time. These kids turn up in my office and they say, I talked to my dentist about fill in the blank here, closing my space a little bit. These little white spots I have on my teeth after my orthodontics, a little brown spot, tiny rotations in my teeth. And so many of us think, well, you have great looking teeth. This would be considered a beautiful smile before. And we're saying to them, you're fine. You're totally fine. Your teeth look great. There's nothing you need to do. You keep them really clean. It's going to be fine. And as dentists, we're thinking, I just solved the problem. I took care of that kid's problem. Why? Because I'm the doctor. It says so right here. I'm the doctor. And these kids are hearing this, and are they thinking, sure, the doctor told me to be happy with my teeth. I will be happy with my teeth. They're not thinking that at all. They are thinking, she is a loser. She doesn't get it. She doesn't understand that I have to look better than I look now, that I can't just go out there in the world like this. And they turn up at my office and other offices, and they go seeking second, third, and fourth opinions until they find someone that'll do what they want to do. And my big fear is that that's going to be deep cut veneers. And if anyone's been watching TikTok recently, you know that's what's happening. Lots and lots of younger people, teenagers, kids in college, young adults are getting deep cut veneers on their teeth because that's what's happening out there in social media. What I advocate for is that we listen to these patients when they're in our offices and when they come to us, and we address their needs. We appreciate that this is affecting their self-esteem and their confidence, the way they interact with the world, the way they perform in school, the way they get jobs, the way they interact with other people. That we hear that and we do something about it. But we do something ultra conservative. So we learn technique, and that's what I teach is technique. How do we get rid of those visible white lesions? We can do resin infiltration. Tiny brown spots, microabrasion. Rotated teeth, possibly clear aligners or altered orthodontics. We can do direct bonding. We can do enamel recontouring. And if necessary, we can put veneers on kids But we want them to be super conservative. We want them to be no prep or minimal prep veneers. And when we offer this to these patients, we are helping them boost their confidence. We're helping them move ahead in their growth and development. I have a patient named Hannah. She's 15 years old. And her mother came to my office for a consultation, and I was the third doc that they came to. And Hannah's 15, and she's a competitive cheerleader. Super kid, tiny, petite little girl. So she's a flyer. She's the girl that they throw around, and they throw around, and she's at the top of every pyramid. And Hannah's in my office not smiling at all, and we've got to put the cheek retractors in to really see her teeth. But we ask her to smile, and she gives us one of those big closed mouth smiles. And her mother says, I've never seen her smile with her teeth. She's so conscious of it. I'm really worried about her. I think that she thinks about it all the time. And when she's cheerleading, she just never smiles. And she talks about the other girls' teeth and how beautiful they are. And look, here's a picture that's off her Instagram feed. And it's 6 girls with big white smiles and Hannah smiling with her mouth shut. Can you do something for us? She was just coming out of ortho. So she had very small teeth and spacing between her teeth and kind of yellowish teeth. And her dentist, who her family loves, by the way, told her that he would do something about it when she got done with college. He thought she needed to wait till she was finished with college, and he was going to put full crowns on those teeth, do some crown elongation and put full crowns on those teeth. And I think that's kind of a traditional approach, and I think we see that sometimes. But this is 15-year-old Hannah, and we're going to make her look like this all through those so important teenage years, end of middle school, high school, and college, with teeth she hates. I ended up diagnosing for her minimal prep veneers, gingival sculpting, and whitening, and we did a little diastema closure with bonding on the bottom. So minimal prep veneers for us, for me, is just a very soft chamfer of a finish line on all of her teeth. I did 10 veneers on the top. And disking with a soft flex disc, all of the rough contours and sharp anatomy, the sharp corners of her teeth, so her ceramics will work. So we have her in for a prep appointment. It takes a couple hours for us to do everything we need to do, and I put her in a set of provisionals, and these are always a prototype. They're a pretty good mock-up of what I think her teeth should look like. Thank you. A pretty good mock-up of what I think her teeth should look like. And I send her home and I say what I always say, Hannah, be careful. These are just plastic. They're very lightly bonded on, and don't eat anything with them. I want you to cut everything up with a knife and a fork and eat it on your back teeth. They're for you to take a look at. I want to see how you do. And I give her mom my cell phone number, because we do this to many of our patients, makes them feel more comfortable. I say, call me if you have any problem. This is Thursday. Friday afternoon, I'm having my day off. I feel my phone buzz. I look at it. It's Hannah's mom. And you know what I'm thinking? Oh, why don't they listen to me? I said don't bite into anything. I'm thinking I'm going in on the weekend to fix Hannah's temps. I open it up. It's a picture of Hannah, and it's Hannah at the top of a pyramid with the biggest, toothiest smile, and a note from her mother that says, thank you, thank you, thank you. I've never seen Hannah smile before, exclamation point, exclamation point, exclamation point, exclamation point. And that's what makes me feel good. I know I am helping her. That's what makes me feel like the doctor. To give them the confidence that they need to move forward with their lives with responsible and conservative cosmetic dentistry. So when she compares, she no longer despairs, but she's looking at herself with a little bit of self-love and self-care. Thank you.